It is largely accepted in the field of early childhood education that the most important aspect regarding quality and children's early experiences is caregivers, interpersonal and interactive skills. That is, how caregivers create warm and secure environments with rich learning experiences. Interactions between caregivers and children should therefore be the focus when considering quality. Positive relationships and secure attachments between caregivers and children lay the groundwork for children's social emotional development and well-being. In order to promote secure attachments, it is important that caregivers show positive and supportive behavior, for example, through being sensitive and responsive and respecting children's autonomy. Quality of attachment at 12 and 18 months is found to be a strong predictor of children's behavior at age 4.5 to 5 years, and children who have experienced secure attachment at a young age become more independent, compliant, empathetic, and socially competent compared to children who have experienced less secure attachment. Sensitive, responsive caregivers enable emotion regulation in infants and toddlers, affecting children's brain development and wiring of the brain for learning. Research has revealed strong positive associations between caregiver responsiveness and children's language development, and children benefit from caregivers who promote extended conversations, for example, using a variety of questions and encouraging turn-taking, and who provide more advanced expressive language models, such as expanding and extending children's utterances and language. Supportive relationships between children and caregivers are also associated with the development of children's pro-social predispositions. The evidence is clear. Caregiver-child relationships are at the center of quality caregiving. Studies from across the world, Australia, Chile, China, Netherlands, USA, find mid to high levels of interactional quality for emotional basic supportive interactions and lower levels of quality for instructional educational supportive interactions. As an example, one recent study from the Netherlands found that caregivers engaged in basic interactions, such as emotional supportive interactions, at a moderate to high level and engaged in educational interactions, that is, instructional interactions, at a moderate to low level. But what should we consider as quality interactions between caregivers and infants and toddlers? When examining quality of interaction, interactions between caregivers and children are often analyzed by using rating scales. Interaction quality criteria in these tools are often described as caregivers' individual characteristics, interpersonal or interaction skills. The Caregiver Interaction Profile Scales, CIP, is a tool which focuses on how caregivers respond to children's signals and respect children's autonomy, basic interactions, as well as on how staff stimulate children's development, educational interactions. The CIP scales describe different interaction skills assumed to have a positive impact on children's well-being and development. The skills are conceptualized into two main areas: basic interactions and educational interactions, with the first three scales describing basic interaction skills and the three latter ones describing more educational skills. Sensitive responsiveness refers to the extent to which a caregiver recognizes children's individual emotional and physical needs and responds appropriately and promptly to their cues and signals. Sensitive responsiveness is a basic quality of interaction and a tenet for developing a secure attachment, according to attachment theory. Respect for autonomy refers to the extent to which caregivers are non-intrusive and recognize and respect the validity of children's intentions and perspectives. This is an important quality from Erikson's theory, especially during the second year of life. Structuring and limit setting refers to the capability of a caregiver to clearly communicate expectations toward children and structure situations accordingly, and to set clear and consistent limits for children's behavior. This quality reflects the parenting style often referred to as authoritative parenting. Verbal communication refers to frequency and quality of verbal interactions between caregivers and children. Both the quantity and quality of interaction exposure is considered. Developmental stimulation concerns the degree to which a caregiver deliberately attempts to foster children's development, that is, motor skills, cognitive development, and creativity. Presenting individualized developmental challenges within a practice that is developmentally appropriate. Fostering positive peer interaction refers to caregivers' guidance of interactions between children. Unlike the other 5 qualities of interactions, this one acknowledges the caregiver's role in moderating positive interactions between infants and toddlers themselves. The following data comes from a study that applied the 6 interaction types from the Caregiver Interaction Profile Scale to the everyday interactions between caregivers and infants and toddlers. The results showed that infant and toddler caregivers received higher scores for basic interactions than they did for educational interactions. For basic interactions, sensitive responsiveness, respect for autonomy, and structuring and limit setting, all the mean scores were within the adequate to good level. In comparison, all the mean scores for educational interactions, verbal communication, developmental stimulation, and fostering positive peer interactions fell within the inadequate level. The highest average score was for structuring and limit setting, a very basic interactional quality. The lowest average score was fostering positive peer interactions, followed by the other 2 types of educational interactions, developmental stimulation and verbal communication, respectively. Without a doubt, these 3 lowest scored interaction types are important. So why are caregivers not engaging in them more? While this one study has several limitations, such as only using 10 teachers, conducted only in Norway, only 8 to 10 minutes of interaction time were analyzed, etc., it nevertheless provides significant insight into various features of quality adult-child interactions, a tool that can be used to measure these interactions and which specific interactional features infant and toddler teachers may need more training on. In summary, the results of the study suggest that infant and toddler caregivers engage adequately in basic interaction types, but engage inadequately in educational interactions. Here are some questions for infant and toddler caregivers to consider. When you read over the 6 types of interactions from the Caregiver Interaction Profile Scale, are you aware of which types you may need to personally improve in? Why do you think caregivers scored so low for the 3 educational interaction types? Knowledge? Training? Program policies that are restricted or absent, such as primary care, small groups, continuity of care, individualized care, culturally responsive care, and inclusive care? For each of the 3 educational interaction types, what are strategies that infant and toddler caregivers could use to improve their interactions?